Talk Radio 640 WGST. Welcome to HealthTech Talk. This is where business, healthcare, and technology collide. Our host, Ben Chodor, interviews healthcare innovators and industry titans who are striving to make the world healthier with bleeding-edge human ingenuity. You'll hear it all on HealthTech Talk. Now, here's your host, Ben Chodor.
Good morning, good afternoon, good evening, wherever you are. I'm Ben Chodor, and you're listening to HealthTech Talk, broadcasting live from 640 WGST, iHeartRadio, and broadcasting worldwide on the iHeartRadio network. I hope everyone's having a great day. April is just around the corner. I'm really excited about spring, and I think with spring comes taking care of your health, right? So today's show, and every show, is all about health and technology. But I have two amazing guests today, and we're going to cover a wide variety of topics today. But I really want to start off with my first guest. It's Dr. Mitch Morris. He is the Vice Chair and Global Leader for Healthcare Provider Practice for Deloitte. Dr. Morris is, he's done it all right? So he's worked in the clinical setting. He works for Deloitte. He understands the business side of healthcare, understands the healthcare side of healthcare, and being part of Deloitte means that one of the most respected companies in the world, he has access to things that you and I, listening and participating in the show, don't. Dr. Morris, welcome to the show. How are you today?
Great, Ben. Thanks. It's good to be here.
All right. I want to jump right into this. So first, how does a doctor, a clinician, a doctor, end up working for a global giant that I think of around this time of year because of my taxes and auditing? How does a doctor end up there?
Well, that's a great question, and I wonder that myself sometimes. I started out in clinical care as a cancer surgeon and got very interested in some of the problems that we all experience every day in healthcare, and that's how do you know you're getting good quality, how do doctors make good decisions, how do nurses deliver the best care, and how do we do it less expensively? We spend so much on healthcare, and as I got interested in those problems, I got bit by the business bug and have been involved in a number of initiatives around electronic patient records and healthcare outcomes and quality over the years. And Deloitte is in the middle of that. Deloitte is a company that not only does taxes and audit, but a very large presence advising our clients, consulting, and building solutions with clients in healthcare and life sciences all over the world.
So I guess if you get used to working with a huge company, because when I built my first company, I sold it to a 40,000-person company, several billion-dollar company. And one of the biggest educations I had to go through was, learning how to deal with a big organization. But one of the best things is I went to bed with, one day with 60 employees, an office in New York, a small office in London. I woke up the next morning with, 40,000 coworkers and offices in 20 countries, and the access that it gave me in my world of digital was amazing. So I got to assume a little bit when you join an organization like Deloitte, the access that it gave you for what you do is unparalleled.
Well, there's no question of that, Ben. There's an awful lot of smart people at Deloitte, and I get to do different things every day. And not only are there a lot of smart people at Deloitte, but being with a company like that gives us access to really smart people at many of our clients. And our clients range from startup technology companies who just have a great idea and are trying to get it off the ground to very large established household name companies, which you would all recognize the names of, and everything in between. So it is tremendously stimulating to work for a company with that kind of scale and reach, and it opens a lot of doors.
How important is healthcare to Deloitte practice, not just internally for employees and their own health, but more importantly on the business side and where it's going and what we're going to talk about, the whole world of digital and M-health?
Sure. Well, healthcare is arguably the largest industry in the world. Here in the U.S., we spend between 17 and 18% of the gross domestic product on healthcare. That's a lot compared to all other countries, but even if you look at other industrialized nations that are with developed economies, they're spending about 9% of their GDP on healthcare. So it's an incredibly important industry, and prices keep going up. It's a time of amazing discovery in healthcare, and I'm sure you've talked about on the show before, the unraveling of the human genome and how we're making new discoveries around precision medicine and targeted therapies, and how information technology is impacting how we deliver these new therapies to the bedside and, more importantly, to the home, and not only improve how we take care of very sick people, which we have done, but also how we can prevent people from getting sick much more effectively than we ever have in the past. So for us at Deloitte, this is one of our biggest businesses, is the healthcare and life sciences business. It continues to grow, and there are some real problems, not only in the U.S., in every other country, as our populations get older, we all age. Illnesses like cancer, we're surviving them, and they become chronic illnesses, and with that comes expense and challenges and complications and how you live as a survivor. That's just one example. So we're trying to figure out how to deal with all of this as an industry. So it's an incredible, the business of healthcare and the technology of healthcare keep becoming more and more important pretty much for everyone in the world.
So let me ask you a question. 5-6 years ago, there was no such word as digital health or mHealth. So how are mobile apps, is this revolutionizing healthcare? Is it making a big difference? Do you see a difference?
We're starting to see a difference. There's tremendous creativity going into the creation of mobile applications and wearable devices and shifting care from the hospital to the office to the workplace to the home. So some great examples that everyone's probably familiar with are Fuel Bands, Fitbits, and all the other Apple Watches and all the other things that are coming out that monitor different physical capabilities. Are they revolutionary? Probably not yet, but they're trying to figure out how we get there. And there's steps along the way. You can use mobile apps to do things like check the wait time at your local emergency department before you show up there and even register. You can track your medications and your allergies and weight loss. So those are all interesting things. But some of the most dynamic advances are how we monitor people at home. So, for example, you might have asthma, and you blow into something called a spirometer, a little tube that's hooked up to a Bluetooth device that's hooked up to the Internet and goes to a system that measures whether or not this is what you could do yesterday. Could you move air in and out of your lungs yesterday that well? Or is it perhaps less, because maybe the air quality is not that good today? And if you're having an impending asthma attack, it can then trigger a series of events where we make sure you're taking your medication. Someone calls you at home, asks you how you are, has the pharmacy send you a rescue inhaler, and helps you overcome the asthma attack before you get sick enough and end up in the emergency department. So apply that to COPD and heart failure and diabetes and so many other illnesses that Americans suffer from. How can we take care of them at home with ongoing monitoring? So at Deloitte, we do surveys through our Center for Health Solutions, and one of the surveys that we do every year is of consumers. And it's very interesting. If you ask consumers, if your doctor gives you a prescription, how likely are you to get it filled? The answer is about half the time. And then if you get your prescription filled, how likely are you to take it the way your doctor told you to take it? The answer is about half the time. So 1 in 4 people are taking their medicine the way the doctor prescribed. What if we had some interventions at home with reminders, using smartphones and other devices to help people remember to take their medications, programs to help make them more affordable because sometimes price is the issue. So for problems like high blood pressure, high cholesterol, diabetes, things that you need to take medication regularly for, and if you do, it prevents all these complications downstream. That's transformational, that's revolutionary, and it involves mobile apps, mHealth, and doing it at home. So that's where I get really interested.
Doc, so if it's using technology just not for technology's sake, it's using technology to make real-world differences and creating better health. I need to take a break, Doc, and we're going to be right back because there's so much more I want to go over. But everyone, you're listening to Health Tech Talk. I'm Ben Chodor. We're broadcasting live on 640 WGST on the iHeartRadio network, and we'll be right back.
Hello all, I'm David Nicholas, host of Protecting Your Retirement right here on 640 AM WGST. We've got a new showtime starting Saturday at 10 a.m. and Sunday at 10 a.m. right here on 640 AM WGST. We hope to see you then.
Buying a car can be the worst. Scotty from the Power Morning Show. Unless you're using TrueCar.com, they're helping you save time and money. Two things we all wish we had more of. Helping you to never overpay. Users see an average savings of over $3,200 off MSRP. It's a pretty simple three-step process. First, you go to TrueCar.com and find out what others paid for the same car you're looking for. Second, register at TrueCar.com to see your upfront pricing information and lock in your savings certificate. And third, it's simple. Just print out your certificate and take it to the TrueCar certified dealer for a better, hassle-free car buying experience. Don't buy a car without using TrueCar.com.
Flo from Progressive here, making deliveries with Greta, who has her own flower shop. Greta's Great Green Thumb. Yep. Greta is saving a bunch of money on her commercial auto insurance with discounts like Safe Driver, Business Experience, and Paid in Full. Right, Greta?
Righty-o.
Righty-roo.
Correct-amundo.
Yes, sirree.
Wait, who are you calling sir?
What? No one. I thought we were doing a thing. No?
Yeah, no.
Discounts to save your business money. Visit Progressive.com to learn more. Progressive Casualty Insurance Company and affiliates.
Would you like an extended warranty with your new refrigerator, sir?
Ma'am, an extended warranty for your washer provides extra protection.
Well...
And what about an extended warranty?
An extended warranty is recommended.
An extended warranty?
No thanks. I have complete coverage with Total Protect.
An extended warranty is definitely something you should have, but buying a separate one for every appliance would cost a fortune. Now with the Total Protect Home Warranty, one plan can help cover the repair and replacement costs of up to 20 of your most vital home appliances. From your water heater to your refrigerator or your plumbing system, you can even choose to cover your electronics, like your computer or TV. At Total Protect, you'll have total control to personalize a plan to fit your needs and budget. When breakdowns occur, our 180-day workmanship guarantee provides total peace of mind. For free information and a no-obligation free quote, call Total Protect at 1-800-900-9460. That's 1-800-900-9460. 1-800-900-9460.
This is Jeff Foxworthy. When I was growing up, I had heroes like Batman, Spider-Man, and any man scooping ice cream. Today, my hero is an organization called Cure Childhood Cancer. They are doing all kinds of heroic things that you should know about. The moment a child is diagnosed with cancer, Cure joins the devastated family and stays with that family throughout their frightening journey, however long or bad, providing guidance, compassion, and whatever help that family needs. And that relationship is forever. Cure works year in and year out to provide badly needed funding for the specialized research required for childhood cancer. This critical funding is working, folks. We are getting closer to eliminating this dreaded disease in our lifetime. You see, Cure would never use the word hero. They'd use the word help. Please help Cure save children's lives. Believe me, you'll be a hero too. Donate at curechildhoodcancer.org.
Show where you're the judge. The 2015 iHeartRadio Music Award, hosted by Jamie Foxx. Here we go! The best music, decided by you. And special appearances from Taylor Swift and Justin Timberlake. See it all live tomorrow on NBC. Brought to you by the AM Crunch Wrap from Taco Bell. The next generation of breakfast is here. Wake up, Liv Moss, proud partner of the iHeartRadio Music Awards at participating locations. Talk Radio 640 WGST.
Welcome back, and if you're just tuning in, you're listening to Health Tech Talk, broadcasting from iHeartRadio Studios, 640 WGST, and streaming worldwide on the iHeartRadio network. You know, in the first segment, I've been talking to Dr. Mitch Morris. He is the vice chair and global leader for healthcare provider practice for Deloitte. We got into the patient side. We talked about where healthcare was going in the digital space. It was really compelling. And in this segment, we're going to dig deeper into some of the surveys that Deloitte has done, has the privilege of doing. But also, before we jump into that, we were talking about, apps and, related medical devices. Doc, do you have a favorite device or wearable or app out there right now?
Well, I use one of those ones that goes, I don't want to recommend a brand, but I use one that goes around my wrist, and I've lost a couple of them in the laundry, unfortunately, but I keep getting them again, and it tells me how far I've walked every day. And I know I don't sleep that well. It tells me that, too. But the thing about knowing how far I walk is really helpful because it encourages me to get off my rear end where I spend too much time and walk around when I'm talking on the phone and thinking, and just get outside the house sometimes.
I'm the same way. You know, it's funny. I got so addicted with my wearables and getting to my 10,000 or 12,000 or 14 steps that I'd find myself standing in the airport walking in a circle, or sometimes driving into the city. If I was at a light somewhere, I'd spin my arms around, even though I know it wasn't real steps, to get those fake steps. It became sort of a gamification to me, but it was something that was always in the back of my mind. And I kind of believe that if it gets you to do something, then it's good. And keep yourself active. You know, that's the first step into being healthy. So I want to jump back into this. Do you think that, are you surprised or underwhelmed or overwhelmed how much has changed in the last 2 or 3 years? Or do you think we're still behind the times where we should be with digital and mobile health?
I think we have a long way to go. I don't think it's as much an issue of the technology itself, but who pays for some of these things? We have some amazing technologies that we can put in place that can keep people healthier, out of the hospital, preventive maintenance, all those good things that we talked about in the first segment. But it's hard to figure out in the American health system who wants to pay for that. And some of the work I do in other countries where they have a nationalized health system, so there's an interest in their government in saying we got to keep everybody healthy, then these things are moving along a little bit more quickly. And I think if you look at what Health and Human Services is doing through the Obama administration, they're incentivizing some new types of payment models under the broad heading of value-based care. Let's pay for value. Doesn't matter how many procedures you do, but did we really get value out of it? And value-based care is rewarding doctors, nurses, hospitals, health plans for good outcomes rather than how much they do. And if you have that type of reward system, it will incentivize the adoption of technology. Compared to other industries, healthcare is behind. There is no question about it. And a lot of it has to do with an alternative business model. And I often use the example of ride-sharing applications. It's not brilliant technology. The technology has been around, to enable that for a while. It's a new business model. The business model of ride-sharing is transformational, and we use technology to enable it to begin with. But first, someone had to come up with a new business model. Right. That's what we're trying to do in health.
Right, and I guess you could take that into any industry, right? Before, people were using coupons forever, but before Groupon, it wasn't one of those things that you just constantly got. And you could go industry by industry, how technology has sort of transformed it. So I'm going to teeter into a question about, health IT, which is something that one of your expertise. But I wanted to start off with, I always thought the providers, more so the payers, I always thought, we'll call them the Aetnas, the Cignas, the Uniteds of the world, would have been the first to totally jump on to the digital health. Because if you keep the patients healthy, you keep them active, they take their medication, they're less likely to go into the hospital or to see, and then obviously it cuts the cost of health care. It has surprised me that they haven't jumped onto it. But I know one of the things that you specialize in is, talking to health IT. So are you surprised, or what do you think the view of health IT is to the provider networks?
Well, providers have adopted health IT broadly in droves over the last 5 years, and it was stimulated by federal funding for this, the HealthTech Act, and billions and billions of dollars were available in subsidies, and people took advantage of it, implemented electronic health records. So pretty much every doctor's office and pretty much every hospital has some form of electronic patient record at this point. Now, the question is, so what? Do we get anything out of that? And the Deloitte Center for Health Solutions did a survey of physicians just this past year and found that 3 out of 4 physicians said electronic health records waste our time and cost too much money, even with all those subsidies.
Well, can I interrupt you for one second? Did that, as a physician, did that surprise you?
Well, there's physicians who have been enthusiasts, which I count myself in that category, about electronic health records, and then there are those who have been skeptical. And physicians today are incredibly busy, and they've always been busy, but today, because of the changing economic environment, they're being asked to see more and more patients. We as consumers or patients, when we go to see a doctor, do they spend as much time as they did with us 10, 15 years ago? No, it's less time. Other surveys have shown that to be the case. And when they are also being asked to enter in the electronic medical record data, it becomes a problem. And one of the fastest growing jobs in this country, and this is a very sad commentary, is a job called being a scribe, a physician scribe. If you're a scribe, your job is to follow the doctor around and listen to everything that's said and write down little notes and then enter it in the medical record later. Now, that can't be the vision of how technology is transformational. And it's really using technology when you're interacting with the patient in a way that doesn't interfere with the doctor-patient interaction and relationship. And that's where the art of this comes in. So I think we've got the technology and the science down. The art part, which is how to effectively enter information and get information back out without interrupting the flow of your conversation with a patient, and being able to make eye contact with them and have them feel you're paying attention to them, that's the challenge. Because today we get feedback from patients in our consumer survey that it doesn't feel like doctors are paying attention to us the way they used to. And we get feedback from doctors saying, I can't pay attention to my patients. I'm tapping on the keyboard. So I think we have a lot of work to do yet with electronic health records so that the workflow is more effective and efficient. We enable team-based care, so teams of doctors, particularly for complex conditions like cancer, teams of doctors can work together to give you the best treatment they possibly can, and also work with other professionals like pharmacists and nurses and physical therapists and so forth. We've got to manage the cost and some of the things that are going on in the cloud and software as a service, and some of those innovations I think will help us get the cost down some. And we've got to look at our workflow, our work processes. I think a lot of organizations automated the old way of doing things. So the whole point of automation is we should be able to do things differently. And if you do things the same old way you always did them, automation is just an extra cost that takes extra time.
And it doesn't happen overnight, right? And it's not supposed to happen overnight. But at least there's some conflict going on. People are talking about it. They're trying to do it.
They are. And the health plans are involved. The hospitals and health systems, doctors' offices are all on the journey. And best practices are emerging. I think the good news is progress is being made, and it's just slower than people would like. And along the way, Mark Twain once famously said, "I'm all for progress, so long as I don't have to change." And the health profession is similar to that. We want to make progress, but nobody wants to change at the same time.
You still got to treat the patient. I have a couple minutes left with you, but one thing I wanted to ask you is from the 2015 physician survey findings, can you give me like 3 or 4 other key things or things that you found interesting from this survey?
Well, sure. One of the other things I talked about was value-based care, right. And it really starts paying doctors for the value of the treatment they deliver. So if you like to play golf or tennis and you can't because your knee hurts and you need a knee replacement, today maybe we measure how many days you spent in the hospital or how much blood they lost in the operating room. But the real measure is, did you go back 3 months, 6 months later, and are you playing tennis or golf again? That's the real measure of success, because that's why you had the operation to start with. So looking at those kinds of measures, figuring out how can we deliver care for a lower cost is very important. And in our survey at Deloitte of physicians, we found that nearly all of them are taking some form of value-based payment, some quality-based payment. They get paid more or less because of quality. But it only amounts to about 5% of their income. So they're dipping the toe in the water, but they're not going swimming yet when it comes to this move to value. But when we asked them, what do you think is going to happen 10 years from now, they said, well, we think about half of our income will be based on the value of what we actually do. And while they're anxious about it, maybe it wouldn't be a fair system, maybe there'd be things out of their control, they're also excited about it, recognize the need for moving from a value-based system, which is where the incentives are a little bit perverted. We read in the newspaper about an ophthalmologist in Florida who's injecting eyeballs with Avastin, which treats macular degeneration, and he's actually making $40 million a year. And you go, how can that be possible? And how can that be right? It's embarrassing. And those are some of the things that value-based payments and some of these new approaches to health care will really deal with it. It's a complex time of change, and we're trying to navigate it.
All right. Doc, I have about 20 seconds left with you. Is there anything you want to leave our audience with? And also, if you came back in 5 years, what do you think the topic we'd be talking about is?
I'm terrible. I don't have my crystal ball. I'm terrible at predicting that. But I think in 5 years we will have some new models of care that put the consumer, the patient, at the center, not the doctor. I think that's key, and I think technology will enable it, and a lot of that stuff is going to occur at home and not in a hospital or a doctor's office. That's what I'm really looking forward to.
I love it. Thank you, Dr. Morse. This is one of the best interviews I've ever done. I can't wait to get you back on the show. I need to cut to a commercial, but before I do that, I want to give a special thanks to 1-800 Public Relations for all their PR and media support, and everyone at Stream VPG will be back.
Talk Radio 640 WGST.